Cartier City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
We have a disclaimer up, thank you very much. Okay, today's speaker, apologies if I get your name wrong when I pronounce it. It's Dr. Well, I'll take my glasses off, sorry. Dr. Kothi Ranarak. Okay, good. Okay, MD from the Bangkok Hospital, Mathias Orthopaedic Centre. His speciality is spine surgery, and he will speak on the topic of what happens when you have back pain and how minimally invasive endoscopic spine surgery technology can help you. He received his medical degree in 2011 from Chulalongkorn University Pre-Medical and completed his internship at the residently at Queen Savannah Vanhara Memorial Hospital. And he's certified by the Thai Board of Orthopaedic Surgery. And he has a fellowship in spinal surgery as well. And following this, he did research fellowships in the USA. By the look of it, he's learned an awful lot. So it's going to be very interesting to hear what he's got to say to us. So will you please give him a warm PCEC welcome.
Well, good afternoon, everyone. My name is Kothi Ranarak. It's quite a long family name. So what I'm going to talk about today to you guys is about back pain. This is a very common problem, the back pain. And I will introduce to you I would say, is the minimally invasive surgery. What kind of MIS surgery or minimally invasive surgery today, right? So that's my, CP. So what is low back pain or LBP? What is low back pain? Any one of you never got low back pain in your life? Never? Oh wow. Okay, good. Okay, let's talk about low back pain. What is it, low back pain? It's the unpleasant feeling that you feel in your low back. It's between here to here. It is low back pain, right? So it could range from a very dull, constant pain to a very sharp, like irritation pain. So the onset time and timing, the onset in the medical term, we divide into acute phase, which is less than 6 weeks, and 6 to 12 weeks is the subacute phase, and we determine the back pain that is more than 3 months or 12 weeks as a chronic low back pain. It could trigger by any activity, like when you lift something, when you twist your trunk like that, it could trigger the low back pain, right? So what structures make up the back? I would say this is very fundamental vertebrae. We call it lumbar spine, right? So there's 5 lumbar spine in our body. In there's a nerve there, and there's some exit of the nerve root here that supply your leg and the motor of your leg as well. And this is the structure that I would say is commonly contribute to the low back pain. It's the muscle and ligaments in your body. So who gets low back pain? From the study, they show that in a single adult, 80% of them once have low back pain in their lifetime. So is age related? Yes, I would say the first attack of the low back pain would come around 30 to 50. And when your body like gets older and I would say it's wear and tear process, it could be the low back pain come afterward. It could be work related if you lift something too much, and if you, I would say, if you travel for long distance with some bouncing like that, you can have low back pain. Or it could be internal related, like genetic or whatever. So when does low back pain matter to you? The first thing, low back pain can resolve by itself. The body can heal itself, right? So if it's not resolved, I would say in 6 weeks, that's a problem that you might want to concern about it. Or if you have accompanying leg pain or numbness down the leg, that's a problem. If you could not walk for long distance, if you need to stop for a while when you walk for long distance, that's a problem. Or the back pain that is increased in intensity, like when time goes by, the back pain tends to be more intensity. That's the problem. I would say in the medical term, we call it red flags of back pain. If you have any of this, you might consider need to go to see the doctor. The first one, if you got malignancy history, if you have unexplained weight loss or loss of appetite, if you got recent fever or shield infection, if you have immunosuppression, or if the pain is at rest when you lie down, the pain is still there, that's a problem. Or it's a nighttime pain, that's a problem. If you have recent trauma or accident, maybe that's a problem. Or accompanied by the bowel and bladder dysfunction. Right? So from physical examination, there could be some deficit in your lower extremity or your leg, or you have anesthesia, if you have fever, if you have anal weakness. Okay. So how is it diagnosed? So it's by history. Very common, it's by history. If you lift something up and you feel like, oh, I got back pain, that's a low back pain. But when you come to see doctor, we might examine you further to test about your nerve function, to test about your, the local of tenderness. We could check about that. Or we could send you for the imaging that would help, the X-ray, the CT scan, or the very detailing MRI. It's very easy to do. So how is it treated? The low back pain. Is the cold pack and hot pack helpful? From the study show that the cold pack and hot pack is I would say is the first to help you to get rid of the pain, but it doesn't. I would say it doesn't shorten the period of low back pain, but it could help. Yeah, it could help about the pain. Should you rest when you got low back pain? The study said that if you rest too much, it's not good for you. The best thing to do is to do the slight stretching exercise when you got low back pain, taking medication, and slowly return to your activity as soon as possible. Not to get lie down all day, it's not good for you, right? Or you could go physical therapy. There should be some modality for you, such as ultrasound, TENS. This modality could help you to get rid of the pain. Or, what is this, candies? No, I don't think so, that's the medication, right? I would say all of you, I know about the medication, but what medication that we use for low back pain? This is the very common one, analgesic medication or over-the-counter medicine. It could be paracetamol, it could be counter-irritants like spray or balm, tiger balm in Thailand, right? Or this is the main thing that I would say is very helpful, or we call it NSAIDs, non-steroidal anti-inflammatory drugs. This is over-counter medicine too, like ibuprofen, right? Voltaren, like that. Or if you see the doctor, we might prescribe you some anticonvulsants or antidepressants. If you got like accompanying leg pain, if you got chronic low back pain, we might consider giving you all this. So when you need a surgery, when I would say if the low back pain is accompanied by the leg pain, or your nerve is damaging or pinching by this kind of, I would say, degeneration or degenerative process, we might consider surgery if we call it conservative treatment or non-surgery treatment failed to help you. So that's what we're going to do about this surgery. So if we talk about the spinal surgery, it can be divided like easily into two parts, the non-fusion surgery and the fusion surgery. If your bone got instability, we might consider to do the fusion or put some screws, put some metal in your back, right, to stabilize it and to fuse it to one unit. But many options of non-fusion surgery, vertebroplasty, kyphoplasty, you might have heard of that, spinal lumpectomy, decompression, discectomy, nucleoplasty, or nowadays we talk about laser surgery, right? So that's the, we can divide into the non-fusion and fusion surgery. So let me talk about the back school. Back school is a very good concept. Actually, it came between 1970s by Swedish something, I don't remember the name. So the back school is the thing that we need to emphasize to, to help your back to be healthy all the time. It will focus on the exercise, the back exercise, which is very important, but it's hard to do, right? The exercise, the ergonomics, like when you do activity, living, when you sit, when you drive, every activity you do, we will focus on that, the back school, and the psychotherapy. So this is, I would say this session is a little bit assembled to the back school, because I will tell you what to do and what not to do. It's like when you drive, don't do like that. You need the full support at your back and your neck as well, right? Don't do like that. Don't slouch on that. So when you text, right? When you text, don't bend too much. Keep your head like that, upright position. When you work, not bend like that, but keep your back straight with the support in your back, and the neck should be good. When you lift the object, don't do like that. Don't use your back too much. It will got you strain and could cost you more. Do like that. Okay? When you walk, in a good position. And when you sleep, I would say the study suggests that you sleep on one side. Or if you do supine, you put something under your knees. It's a good way to do. Okay? So lifting, do's and don't, call a team to help you, or turn with the leg, not twist the body like that. It's not good. Use your legs, not your back, right? Or use equipment, not do the heavy loads by yourself. So for recommendations, I would tell you about today, which is very, I would say, proper for your, lifestyle and your, I would say the first thing, this is what, walk. But the walk which is helpful to you is fast walking, or we call it power walking. You do it, faster than normal walk. That is the power walking. And this is very helpful, and it damages your knee less than running, right? Or stationary bike. This is very useful too, because you don't need, your back doesn't need to do anything about the this kind of exercise, okay? Or swimming is very good for you too. Or if anyone cannot swim, you can walk in the water. This is very good too. Or Tai Chi or yoga. This is very good for your core muscle and as well as the flexibility of your back and your body. Okay? And nowadays it's very easy. You just go to the internet and type core back muscle exercise. It will teach you how to do it like video. You just follow the video. This is very easy and helpful because I would say focusing on the core muscle strengthening is very important to help and to delay the degenerative process of your back. So to strengthen it is, I would say, is the best thing. Like prevention is the best thing, right? But it's very hard to do, right? And remember, if you do exercises, just do the stretching before exercise every time because you need your muscle to be ready for the exercise. Not just go right away and do the exercise. It's not proper for you. Or, this is ergonomics I talked already, right? To support your back, don't slouch, and the neck support would be good. And for ladies, the high heel is not good for your back, okay? I think I already picked up on that. And sleep on one side, or sometimes with the support under your knees. Eat healthy food. This is very important too, to help to build the body. And quit smoking. Smoking is not good for your blood circulation. It could degenerate your intervertebral disc rapidly more than one who doesn't smoke, right? So that's about the back pain and back school. So let me introduce to you what we're doing in Bangkok Pattaya Hospital nowadays. It's very advanced technology, like I would say in the States or in Europe country, they do like this as a very standard procedure for your back. So we're going to talk about the MIS surgery or minimally invasive, and I'm specialized in the endoscopic spine surgery. I will introduce you a little bit about this kind of surgery. Right. So this is a concept of MIS. What is MIS surgery? MIS surgery. Consider if you want to hit the target like that in the bullseye, right? If you want to hit the target, would you use the cannon to hit it? This is, we call it conventional surgery. Because when we talk about the back surgery, everybody is afraid, oh, maybe I won't be able to walk again, or very big wound at my back, okay? If you hit it with a big gun or cannon, you might hit the surrounding, which you don't want to hit it. We call it soft tissue, right? Surrounding soft tissue trauma, unnecessary. But if you do the MIS surgery, it's like sniper when you hit the target at the center, like that. So surrounding soft tissue is still good. That is the MIS surgery. This is a very clear concept about the MIS surgery. I would say it can be applied to any surgery in the body. This is the conventional wound, right? The big wound in the middle. What if we could do the same work with smaller wound? This is, we call it MIS surgery. You can have like that 10 baht coin, two sides of your body. Or it could be endoscopic surgery, which I specialize in. It could be 1 centimeter wound that could help you. So for MS surgery, it could be divided same as spinal surgery into non-fusion surgery and the fusion surgery. We can do various kind of operation. In the past, we call it tubular surgery. Tubular surgery is put some hollow instrument like that, and we work into that. We put some screw, we put some artificial discs. We could take out the intervertebral disc, which is compressing your nerve root. That is the old time surgery. But nowadays we have this kind of surgery we call endoscopic surgery. We use the camera like that, around 1 centimeter wound. We work that, and we see from the monitor. We use the water irrigation to make everything inside clear, and we can work in there through the monitor like playing video game. But the body is not a game, right? Okay, and we can take out the disc or the, I would say, the degenerate bony part of your back that is pinching your roots, your nerve structures. Okay, from the study it showed that, yeah, in 4 years, it could be no different between people who have surgery and no surgery. But at the first year, the people with surgery do better quality of life. So I would focus on the quality of life when you got this kind of problem. This is for the disc herniation. This herniation is very common problem too. We got a lot of patients from overseas in our hospital. And I would tell that the endoscopic spine surgery is, I would say, is very competitive to the original surgery, to open surgery. So let me show you about this case. So the case, this is 32-year-old man. He suffered from the right buttock pain radiated to his right foot for 3 months, which is failed the medication and physical therapy. He could walk for 100 meters. They need to stop. He got numbness. He got weakness too. So that's his bone. So we can see this. This is the disc herniation from the MRI. So MRI is very detailing tool to tell you about this. So so the diagnosis is the herniated nucleus pulposus or lumbar disc herniation. So we did the endoscopic surgery. So this is the wound side, and this is this herniation that is herniated out of his space, pinching his root. So we take that out through a very small hole, like 1 centimeter. So immediately, post-operatively, his back pain and leg pain decreased, and he could discharge the next day in the hospital. So it means like less hospital stay, less pain from the surgery. Another case, 48-year-old male, low back pain, inability to walk for long distance too. Okay, so this guy, he got, we call it stenosis, or very narrow of the spinal canal, which could happen to your body as well when you grow older. So the space is like the tube like that, but when your body grows older, the space is narrower like that. So this is, we call it stenosis of the lumbar spine. It's a very common problem too. And we deal this patient with the endoscopic surgery as well. So we do like that, and we be able to see the very clear neural structure or nerve structure like that after operation. And one day he could go back to his daily activity. So the last case, 45-year-old Australian male, he came with acute buttock and leg pain for 2 weeks. Come to our hospital. So he's diagnosed as the disc herniation as well here. You can see the big disc coming out of his intervertebral space there. So yeah, again, we did the endoscopic surgery for him. This is a very clear nerve root which previously pinched by the disc there, and we took it out. You can see how it clearly seen there. So that's his disc herniation. We took it out earlier this year. That's his root. You could go back to travel the next day after operation. I would say that this kind of disc herniation is very common. I would say it's not that far from our life. So yeah, I would just or one that is long-standing disc herniation. You could have like scoliosis from the disc herniation after operation. You can see that like the body is like straight there. So scoliosis is not about the bone only. It could happen from the disc herniation as well. Okay, so that's the pre-op and post-op. Okay, and last but not least, I would love you to see our Facebook, the Bangkok Pattaya Hospital. We recently published about the testimonial video. You can see the video there under the session video part, and yeah, there's a Middle East lady came to our hospital and underwent the operation, this mass operation. Okay, so okay, I think that's for today. Thank you so much for having me. If you have any questions, please let me know and you can ask.
Any questions, please?
Yes.
Last year, I was riding on a songtail and I got hit by a truck right back, and it sort of messed up both of my legs. I was in the hospital for several days.
Right.
And ever since that time, my left foot has been numb. I've gone to a couple of doctors here and a couple in America, and they said it's nerve damage, and it's going to be a period of time. But it's been a year now. My foot's still numb.
Still numb.
What do you think I should do?
Did you undergo the MRI already to check about the?
I don't believe I had an MRI. I had X-rays and other things.
So I would say to clearly see this kind of problem, I would say it's a nerve problem, right? So X-ray or CT scan cannot see this kind of thing. We might need to do the very detailed MRI to check whether your disc, are there any disc herniation, or are there any pinching of your nerve structure that could cause you a numbness in your leg like that. I would say you can come to our hospital and we might consider to do the MRI and check about these.
Okay, thank you.
You're welcome.
On your left.
Yes, please.
Yes, good morning, Doctor. I've had the spinal stenosis, and I think it came about from commercial flying for many years, too many.
Right.
And I had a procedure done by Dr. Pissett.
Oh, that's the steroid injection, right?
Yes, I had that. So my question is twofold. One, is it usual to need to have that repeated? That's the question. The first thing is. And secondly, what is the medical approach to the number of opiates being used by the profession there? In other words, to alleviate the pain.
You mean opioid, right? Opiate.
Yeah, well, the opiates being things like Celebrex, for example.
Actually, it's not opioid, the Celebrex. The Celebrex is NSAID. It's non-steroid or non-opioid.
Okay.
That's the over-counter medication.
Yeah.
Yeah.
So what is the
So
approach?
for the first question, I would love to know about the first injection. Did it help you for a long time? How long did it help you for the first injection? 1 year. So 1 year is considered as a good number, because after epidural injection, we cannot predict how long we're gonna last. I mean, how long we're gonna help. So in some would say few weeks until like few years. So it's very varied, right? So if it did help you for a year, I would say you can consider as having another injection after the first time injection. But I would say 2 or 3 injections is enough for you. So and again, we might need to see the detailing MRI, how bad is the stenosis is. So, or any instability coexists there. If there's a very obvious instability, we might need to do the fusion surgery to help that But if there's no instability, we can do like decompression surgery like that through a very small hole like that, and it could help you for years after this. You're welcome.
Okay, I don't really have a question, I just want to comment on what you said. When I was 40 years old, I had a back pain. Somebody showed me an exercise, yoga exercise, very simple, takes about 1 minute. And the pain goes away, you don't have to do it for the rest of your life, you just do it for a few times, and the pain goes away for years and years and years. Even my 90-something years old mother benefited from it, and everybody I knew who had a back pain did that exercise, just lying. Well, I could show it after, if anybody is interested, I can show it after. You just lie down with your face down and your hands in front of you, and then you lift your legs up in that position and you hold it for like maybe a minute or something. And if you do that for a few days, the pain is gone, and it's continuing to be gone for years and years and years. And everybody I knew told me that, well, that's a miracle. So that's probably could be a first step before somebody does the surgery.
That's
do
right.
Something like this.
That's right. That's
and
why.
my mother had to take Novocaine. She had to take the painkillers every day.
Right.
And then all of a sudden we started to do that, and the pain was gone in 2 days for the rest of her life. Until some doctor convinced her not to do that.
I'm not against the yoga. Okay. So I showed on my slide. It's helpful. Yoga, Tai Chi is about your flexibility and your core muscle strengthening as well. So yoga is very good. I mean, things to do.
On the left again.
Oh yes.
Thank you. Thank you for the informative talk. I noticed in one of your slides you mentioned ultrasound. Now, do you use strictly MRI for diagnosis, or do you also use ultrasound, especially when nerve is involved?
I would say ultrasound is helpful in treating. It's one of modalities for physical therapies.
But you don't use it for diagnosis?
Yeah, I don't use it for diagnosis. Yeah. MRI is still very detailing about that.
Doctor, thank you for a really clear talk. I was born with a wedge-shaped, misshaped L2 vertebra. So I have permanent scoliosis and my right shoulder's lower than my left and so. So I wonder, will eventually that vertebra give out? Or is there anything they can do nowadays in terms of reshaping a vertebra or changing it if it collapses and so?
I would say it's not worth to do to reshape the body to straight. I would say focusing on the core muscle strengthening is a very good way to deal with that problem. Because if anyone comes to see me with scoliosis like that, I would say I would like to see how it contributes to the scoliosis like that. It could be from the childhood, you never treated for a long time, or it could be degenerative scoliosis, or it could be this herniation as well.
No, it's genetic, so I was born with it.
Yeah, if it's genetic, I would say if you can live your life normally, you don't need to do anything about that. Just leave it there. But if it might cause you a problem in the future, right? Because from the scoliosis, it's like that. Maybe your nerve is a little bit more easily to be pinched by the spine, which is not straight like that. So when it comes to that thing, then the treatment should be given like that. But now, just focusing on the strengthening of your back muscle, I would say that.
Dr. Ren is a very good dancer, and he dances like you wouldn't believe.
Oh, really?
Would that be good for him?
Yeah, you can.
Yeah, unfortunately, chiropractors kept me out being able to get a black belt in Aikido and also help me with the dancing because I was like lifting women above my head and stuff.
So what kind of dancing you do?
It was freeform part of the dancing. It was called sarong. So it was, you could do it to many different types of music.
Okay. I'll say that's good too.
Are there any more questions, please? Yes, there's one over here. Do
you have an open MRI or is it a closed MRI?
For now, I would say we only have closed MRI. I would say very limited place to have the open MRI. This is very good for the one who afraid of the like narrow space, right? So we only have the closed MRI.
It looks like no more questions, Doctor. Thank you very much for an excellent presentation. Okay, Doctor, don't sit down. Doctor, can you join me, please? There's a certificate of appreciation.